For the first time since 2004, we have a new leader. The leader has always been financial challenges. Since 2004, it's been the number one issue. And so the new leader is personnel shortages of all types, including physicians. So the clinician shortage is significant, but that's not it. I mean, it's across the board, and they're just feeling a significant burden on staff in general. That doesn't come as a surprise to you, does it?
No. I think given what we've been through over the last 2 years, there's certainly probably a correlation now. So if you look at nurses, I guess the one thing that jumps to mind, there's always been this discussion about nurse pay and these kind of things. And now you got a lot more traveling nurses, right? So nurses have decided, well, I'll travel. I'll be a traveling nurse. I'll make more. But that has a consequence, right? Which is now the hospital basically is paying more for traveling nurses because they can't find local ones.
Yeah. So the local nurses, I love that point. I mean, the local nurses leave and they were making standard wage. And then they sign on to be a traveling nurse and they go over here. And by the way, where they just went, those nurses left and became traveling nurses, went over here.
That's it.
And so now there's wage inflation in both places.
So in essence, and as you know, these things take a little bit of time to settle, right? So for a while in the short term, what you have is a difficulty finding, because you're not just automatically putting a switch and saying, let's just switch to traveling nurses. That happens when you realize that you have an inability to find local ones. That's probably part of the issue with that concern today. I think the other one that we obviously all can relate to is the burnout of folks in healthcare after the last 2 years. And if you tie that to what they're calling the Great Resignation, where we have millions of people retiring, that in the short term will also create pressure, right? Because in the short term, folks that you assumed were going to be in their seat for a while still are deciding, I'm done with this and I'm going fishing. So all of that is definitely going to create pressure on a hospital, considering personnel is the number one expense in a healthcare organization.